In order for organizational change to be successful, there needs to be leadership support. The zero suicide model offers a series of goals and steps for successful implementation. We're going to look more closely at them and also consider what it would look like if it was adopted for overdose prevention. Zero suicide goes on to say that it is leadership's role to mobilize staff in the belief that suicide can be prevented and continue throughout its care on the focus of maintaining zero suicides as the goal. Specific steps are publicly announcing the adoption of zero suicide model, training staff on the philosophies, establishing policies and procedures that support zero suicide, and initiating a team for the implementation. What we've seen is that this comprehensive multi-component approach is shown to be successful. Zero suicide reduces prevalence of suicide within the organizations which adopt it. Through reading the current research and meta-studies on overdose prevention, the conclusions are the same. No single approach is going to be successful in reducing overdose. It requires a system-wide approach. And we've seen this successfully implemented in communities, such as Project Lazarus in North Carolina. And the summary of Project Lazarus includes the sentiment, it can only be implemented with leadership buy-in. Another example we have here in New York City is a recent initiative by the New York City Department of Health. It's called Healing NYC, and very publicly announced systemic approach to addressing overdose in New York City. At the Institute for Family Health, we've started to model some of the zero suicide approach steps towards addressing overdose prevention. Through leadership, we have made announcements. Myself and the Director of Psychiatry presented to the Board of Trustees, which includes community members as well as patients and executive management. We've provided organization-wide memos and routinely use social media to announce our efforts towards overdose prevention. Nearly all of our providers have been trained in to have the Suboxone waiver. There's a dedication towards this training, which requires time and resources. It's included in our residency, and we are moving towards having all staff trained as overdose responders, and currently have the expectation throughout behavioral health that the people we serve are coming with complex needs, and to be co-occurring competent is an expectation of the roles. We have established several policies and procedures which support overdose prevention, including our medication-assisted treatment policy, death review, as well as substance use safety plans, and the availability of overdose kits for our patients, collaterals, as well as community members. In order for us to continue making an improvement on how we address overdose prevention, there needs to be an ongoing and consistent support from leadership. I hope in future presentations we are showing some of our results in addressing suicide and overdose prevention.